You all tell me, you all set? Okay. Well, good afternoon. I'm pleased to be here today with Dr. Eileen Davila, our Medical Officer of Health, of course, and we're, again, trying to continue to draw attention to the efforts that we're undertaking as a city, working with our health partners to continue to get more and more and more Torontonians vaccinated for the first time and for the second time. And so that's why we're here in front of this pop-up clinic that is happening in this mall, and it will be here today and in days to come. And I think you're going to see this replicated quite a few times. Before I deal with the vaccination matter, I would like to start by acknowledging the chaos that we're seeing in Afghanistan and the shock and the sadness and the worry that I know this causes for a lot of our fellow Torontonians. The government of Canada is working very hard to help Afghanis who helped Canada. And I think that is something that most Canadians would heartily agree with. And I know that our city will be ready to welcome a number of these individuals and families fleeing Afghanistan, as we have welcomed many others in the past, to our immense benefit as a city and a country in the wake of past conflicts. I just really want the Afghani community here to know that we care deeply about what is happening in their country of origin. Those who have come here from Afghanistan, and I've had the good fortune to get to know that community here in our city, are hardworking, good people, and I hope that all of us will reach out a hand of support in some way or other to the members of that community to let them know that we are trying to provide them with a degree of comfort and support as these terrible tragedies occur in their country of origin. We're also seeing, of course, again, tragically, the rising death toll and the number of people injured in the terrible destruction following the earthquake in Haiti over the weekend. I want to again extend my support to Toronto's Haitian community. I know many people here have loved ones in Haiti and that they're rightly very concerned about the well-being of their friends and family and relatives. That country continues to reel from the devastation of this most recent earthquake. And again, our sympathies as a city, myself as mayor and speaking on behalf of all the people of the city of Toronto, go out to all of those impacted by this latest tragedy. I went to Haiti after the last earthquake with the Red Cross and did a radio and television documentary. And, you know, what you were struck by more so than anything else was the gross injustice that was done to that country and to its people by fate, I guess, if nothing else, in that they face way more than their share of misery and challenges, including natural disasters like this. It's just a tragic thing. And it taught me, though, about the resilience of the Haitian people, watching them try and deal with this, which they've had to do over and over again. I know that many support organizations, some based here in our country and in our city, are working to deliver assistance to Haiti and to the Haitian people. And I want to thank them for doing that and for all those who are donating to the cause and to urge Torontonians, as they did the last time. I remember very well people coming in with jars of coins, kids collecting money to help the victims of the last earthquake. This is a country that's right here in our hemisphere. It is really close to places where a lot of Torontonians take their vacation, but it's a far removed place from all of that. And I just hope we might keep that in mind and try to help them as much as we can and as much as we have in the past. I am happy to be here at the Albion Mall with Dr. Davila today to highlight this clinic and others like it. It is one more example of the groundwork that we continue to do to vaccinate quickly as many people as possible, as quickly as possible. With more than 81% of our residents with at least their first dose and nearly 75% of people 12 and older fully vaccinated with 2 doses, we have had some success. In fact, it's success that is recognized outside of the boundaries of our own city, indeed our own country. But we've got to continue to build on that success. Just this morning, I met with Dr. Davila and with the staff and other representatives of Toronto Public Health to get an update on the ongoing work that we're doing to get more people vaccinated. They are working to make sure that a very significant number of vaccination clinics will roll out in the coming weeks so that we can bring back vaccines to people where they live and where they work. This is the hard part, reaching those who have yet to be vaccinated so they too are better protected against COVID and the Delta variant. And when you get to numbers like 81.4% and 74%, then obviously you have a much smaller number, but you've got the people that are the ones that are going to come out first, and it becomes harder and harder to just work at getting people to come, removing barriers, increasing access, and that's what we're working at right now. We will have to review our focus on workplaces, renew our focus on workplaces, including vaccination initiatives on location, because it is younger working people who are the Torontonians who continue to have in the greatest number the lower levels of vaccination, working Torontonians. So we'll renew our focus on workplaces to try and reach them. Back to school is also coming, and we want all kids 12 and up who are eligible to be vaccinated before they go back to school. And in fact, this clinic here is aimed at everybody, but it is aimed in particular, as we will continue to do, at young people who are preparing to go back to school who are eligible to be vaccinated now. I look forward to the province's announcement that is anticipated tomorrow that, according to news reports, will mandate vaccines for hospital and long-term care workers. I believe this will represent a good step forward. It is the right thing to do, and I commend the province for doing the right thing in this area at this crucial time as we face the Delta variant and the threat that it poses to our considerable progress achieved to date. This is a health issue. This is a health issue. And so I welcome the Government of Ontario and all governments taking all appropriate actions to keep people healthy and to ensure that a healthy population will in turn allow us to keep businesses and public venues and schools open safely in the best interests of everyone concerned. And so as a result, I also welcome the Government of Canada's move last week to proceed with a proof of vaccination system and to mandate vaccinations for federal workers and for air and interprovincial train passengers. I'm also supportive of the implementation process described by the Government of Canada, which will ensure appropriate consultation with people like collective bargaining partners and solid focus on details in what is a somewhat complex matter to implement. As I said last week, I have been supportive from the beginning of some form of digital proof of vaccination being provided to people. They need to have that. And people talk to me quite often as I was just going around and about the last week or two about a cumbersome 8.5, 11 by paper that you have to sort of fold up and put in your pocket. And a digital form of vaccination proof is something that is appropriate. And I commend the federal government for coming forward with it. And I hope the provincial government will just adopt it and say, well, that is something that for provincial purposes as well, people can make use of this. I hope it will also be helpful to businesses and to institutions to keep them open. As we see case counts continue to climb, that all of these different measures will help to keep businesses and institutions open. No one wants another lockdown of any kind, and such a system, both the proof of vaccination and the steps being taken by governments and businesses, will help to prevent another lockdown, will allow business to keep open, will allow the economy to keep strengthening, allow people to keep working, allow businesses to continue to be open. As has been proven in other jurisdictions, these things will also encourage more people to get vaccinated. We know right now that the vast majority of people in hospital with COVID-19 are unvaccinated. Dr. Davila reported to us this morning, and she can speak to this should you want to ask her. Based on local Toronto data, 98.7% of hospitalized COVID-19 cases over the past 4 months have involved people not fully vaccinated. 98.7% of the people who ended up in hospital in Toronto over the last 4 months from COVID were people who were not fully vaccinated. The COVID-19 vaccines keep people healthy, they save lives, and they reduce suffering. And the more people vaccinated, the greater protection that all of us have. We also have the ability right now to vaccinate everyone. We have the capacity, we have the locations, we have the staff. Excellent staff from our own public health and from our health partners. And unlike some of the beginning phases of the vaccination process, we have the vaccines. So there is no reason why anybody need not go and get vaccinated now. The city-run clinics continue to operate either by appointment or by walk-ins. So you can show up at the city-run clinics and get your vaccination on the spot. Or if you prefer the certainty of an appointment, there are thousands of appointments, literally thousands of appointments available at the city clinics. And the quicker you get vaccine, the quicker that we can move forward with more reopening of the city. I know that the case counts over the last week or so can be, as they should be, a cause for concern and anxiety. We can't let up now, both on our respect for the public health measures, including masking and including capacity requirements and so on, and for the need to get vaccinated. But so we should take note of them. But as Dr. Davila and all of our medical health professionals continue to make clear, the best protection we can have that protect your health and the health of loved ones, of coworkers, people around you, the best way out of this pandemic is for people to get vaccinated. And so I'll be out beating that drum over and over again. I'll be announcing some further measures that as a city we will undertake ourselves in this regard, because this is the #1 priority that we have in order to make sure that we can truly, with all the progress we've made, to put this not just to a better place, but put it behind us, put this pandemic completely behind us. On that note, I will introduce somebody who's been an unending source of calm, professional advice and good counsel to our team, and has been, one of the real leaders of our team as we've gone through this entire very long saga, and that is our Medical Officer of Health, Dr. Eileen Davila, and then the two of us will answer any questions you may have.
Good afternoon, everybody, and thank you, Mr. Mayor, for those very, very kind words. If I can start off with this, you would think that after these many months of COVID, that it would actually be getting easier for me to follow the mayor in delivering remarks. And frankly, he just makes it harder and harder, only because he's actually spoken to pretty much everything there is to say, and he's done it incredibly well. So thank you, Mr. Mayor, for being a real public health champion for this city over and above your already very full-time job being the mayor. So I won't speak for very long this afternoon, other than to say, first, thank you to the mayor for being here and for supporting us at Toronto Public Health in our efforts in responding to COVID-19. I would like to thank my team at Toronto Public Health, particularly those that are here today at the Albion Centre, staffing this particular clinic aimed at providing vaccines to this community, all those 12 years of age and older who have yet to receive either their first vaccine or their second vaccine. An incredible effort. I've had the opportunity to meet with Renee and other members of this team on a number of different occasions. And I can tell you that they bring incredible professionalism, incredible skill, incredible passion to their work. And they are eager to provide these life-saving vaccines, these very protective vaccines, to all those who come here to this clinic today. So here we are, Monday, August the 16th, a few short weeks before our school year starts. And, you see people around malls like this all over the city. People shopping, getting ready for back to school, back to work, as is often the case when it comes to, late August, getting ready for the fall. So in addition to buying those books and pencils and all the things that we need to get ready, new clothes even, to get back into the new school year, I would encourage those of you who have yet to be vaccinated to please come to this clinic, come to your primary care provider, your family doctor, a pharmacy. There are many clinics all around the city providing the protective benefit of COVID-19 vaccines. As you've heard the mayor say, yes, there is COVID-19 disease activity that continues here in the city. It continues around the world. But I can tell you this, the best defense we have against COVID-19 is the vaccination. Getting fully vaccinated is the best thing that we can do to protect ourselves, to protect all those around us, and to protect our entire community, and in fact, the very global community within which we live. This is really the best protection that we have. So I would encourage you, as you get ready for back to school, back to work this fall, please, if you have not been vaccinated, come forward, get vaccinated, get that life-saving protection for yourself and for all those around you. So with that, I'll wrap up my remarks, and I believe we're ready to take any questions that people may have.
Well, I think if the message we're trying to give is that as many people as can get vaccinated as possible do so, and that we make it easier for them to do so, I think it follows from that we should be saying that people who work in particularly sensitive kinds of jobs, sensitive relative to the people they encounter, should be vaccinated. And I was glad to see the Government of Canada take steps with regard to their employees and then workers in the federal domain and people who are on airplanes and trains. We understand that the province will announce some measures with respect to healthcare workers and those working in long-term care. And I think that it follows if you are somebody that is going to be exposed, especially to young children, say under the age of 12, who as of this moment can't get vaccinated, that we should be taking every possible precaution. This is about health and the safety first and foremost of those kids and the staff in those schools. And so to me, it stands to reason. I don't know that we'll hear about that tomorrow from the province. I don't know. But I just think that this is something that is a sensible thing to do if we're placing, as I believe we must, health at the very top of the list. It's at the very top of the list. We're talking, it's not about me, it's about us. No matter who the me is, we're talking about us here, all of us, our kids, our coworkers, our friends, our loved ones. And it's time to take that collective view that based on the expert advice that we're getting from people like Dr. Davila and others, that we have to make the maximum effort we can to get everybody vaccinated. Well, I'm concerned, and I'm as concerned as the experts in public health tell me I should be. But you know what? I mean, it's like a lot of things. Ideally, you would aim to have 0 cases of COVID, and it may be some time before we ever get to that stage. I mean, there's lots of things that we vaccinate against where we still have a few cases here and there. But you want to get the number down. So anytime the number is rising, and anytime it's 500 or anything even approaching that, of course you're concerned. The level of concern is best left to somebody like Dr. Davila to address, which I'm sure she would. But I would just say to you that for me, this is no time to be complacent. This is no time to declare victory. It is time to acknowledge progress, but to comment as we did today on how much we have left to do, how much collectively we have to commit ourselves. That's not just government and business. It's individual people to getting vaccinated, to putting aside these arguments that seem to relate sometimes more to law or to politics or to economics, as opposed to saying it's about health. It's about keeping people healthy and saving lives and protecting the safety of our children and the vulnerable people in long-term care and in hospitals and elsewhere. So to me, it's still of great concern. And we got to get those numbers going the other way. And we've been told over and over again, the best way to do that is vaccination. Now, do you want to address the level of concern or question, Dr. Davila?
So perhaps I can add a little bit to that. I mean, clearly, as the mayor indicated, seeing case counts go up is not the direction that we would like to see, whether you're a public health or whether you're a, other city official of any kind. I would say this, however, you heard the mayor mention in his remarks that, of those who are ending up with serious illness, particularly those that have been hospitalized in the last several weeks, the vast majority of those, right, almost 99%, are actually those who are unvaccinated. So I think it tells us, look, we have this incredibly effective protection that's provided through vaccines. So I can't make a better case for vaccine than that. We actually see the real value, that life-saving protective value that's provided by COVID-19 vaccines. We have clinics such as this one run by fabulous staff here at the Albion Center and in many places throughout the city. So I would encourage people to please go out and get that vaccine. Get the benefit of the protection for yourself and for those around you. Well, actually, I think we're seeing here, as witnessed by the people that are coming forward to this clinic today, that there's lots of reason to still be quite hopeful. They've given a number of first doses here today, along with a number of second doses. And we are seeing people taking advantage of opportunities when those opportunities to receive vaccine are actually readily accessible. So that's our plan at this point in time. We're actually finding that the more we are able to specifically address people's questions or concerns around vaccine in a very caring, thoughtful, and professional way, the more we're able to reduce barriers to access. In fact, the more we're still seeing people coming. And many, many doses, thousands of doses still have been provided over the last, several weeks. And I think that's a good sign that it will take us a little bit more time, but we'll get there.
We'll have more to say about that later this week, but I think, again, it's not going to be fitting or appropriate or consistent for me to say, on the one hand, that I commend the federal government for the steps they've taken with respect to their employees, and that I am commending the province for some steps they're going to be taking in the healthcare and long-term care area, and not to address city workers. And so the parameters of what we will have as a city policy for our own employees will be outlined later this week. It is a complex issue. I don't for a minute deny that, but I will also say that I take a considerable lesson from the way in which the federal government is going to implement it, where they're going to go out from having made the declaration in principle of what they're doing and talk to the bargaining units and talk to each individual unit, because they all differ in terms of what they do. But the principle will be one that I would expect you'll see us follow in the next couple of days when we have the details available. Well, I think that's going to be, a lot of organizations are grappling with that. This is the area in which I've said the province, I think, should give some guidelines for large public events, because I believe in my heart that the more we can have a well-understood, non-confusing, consistent series of guidelines for big events, for restaurants, for concert venues, and different things like that, the more we'll be able to keep all those places open and have people stay healthy, which is what we want. And so, to me, I'm anticipating that while tomorrow may deal with healthcare and long-term care, residents and staff, we will see further guidelines and other kinds of policies from the province, because I think there's a need for these to be more than just local. It should be best regionally or provincially, so that we can have a consistency to this. But I think that the more we can do to make sure those places are not just kept open, but when they're open, they're safe, that to me is a good thing. And I look at it kind of like secondhand smoke. We accepted years ago that we're not going to interfere with the right of anybody to smoke. People can smoke if they want. But what they don't have the right to do is to smoke in the presence of other people in public places like that, and have those people potentially get sick from secondhand smoke. And nobody quarrels with that anymore. And I think this is the same kind of instance where we have people, yes, of course, everybody has rights, but there's then such a thing as well as the collective rights of all the people to be healthy, including the 80% that have gone and got one dose and the 75% that have had two. And they've gone to do that. And I think we now have to put reasonable measures in place that give people a choice, but that nonetheless say the better thing to do for yourself and for your fellow workers and your family and for the collective good of Toronto and Ontario and Canada is to get vaccinated. Anybody else? Going once? Going twice? Well, may I just add my words of thanks to, I have a chance. One of the reasons I like to come to visit these clinics is I have a chance to meet the public health staff. Today, I think they're pretty well all public health staff members, but we've had wonderful health partners and so on. But if you think about it, we started this whole vaccination journey, and it was improbable that we started it in the beginning of last winter, this past winter in 2021. And it was a miracle they came up with the vaccines as quickly as they did. And the task of vaccinating 3 million people was, at the time, incomprehensible. And because of these people, under the leadership of Dr. Davila and the other health partners and their teams, we're where we are, which is not finished, but we're well along. And so I want to thank them for their work, and just say to everybody one more time, please go and get vaccinated. There is no longer any reason not to. We've had various reasons before, but they really weren't very long lived, and now there are no reasons. And so there's every reason to get vaccinated and none not to. So please do it, and thank you very much.